Hello everyone, today we will talk about tuberculosis in adults, clinical classification of tuberculosis. You can see this picture lecture plan. Clinical classification of tuberculosis. Pathomorphological and clinical manifestation of tuberculosis are very diverse. The diagnosis of tuberculosis cannot give a concrete idea of the nature of the process and the patient condition. For this reason, it becomes necessary to create a clinical classification of tuberculosis based on the characteristic feature of forms of the disease that have a special cause and require special treatment method. With the development of medicine, the principle of construction or clinical classification was different and depended on the level of medical knowledge and the development of certain diagnosis methods. Each clinical classification was relevant only for a certain historical period and was applied in practice as long as it corresponded to the scientific views of the era. Numerous clinical classifications of the 19th century were not widely distributed and only complete the end of 19th century by Sturban and the reported by him in the start of 20th century. Together with Gerald at the International Congress on Tuberculosis, it was used in medical practice for a long time. The Turban-Gerald classification was based on the so-called epicaudal theory of pulmonary TB progression. It was believed that at first the tuberculation process affects the pulmonary epithelium, the spread to the middle section of the lungs, and finally affects the entry lungs and both lungs. However, subsequent pathoanatomical and radiological observation showed the failure of the theory. It has been found that TB disease can also begin in the lower lobes of the lung. In this regard, other more advanced classification of TB has been proposed. The development of the doctrine of allergies has determined a new immunobiological direction in the study of TB. A new classification by Rankel appeared. Its use free form and stage. Preliminary effect or preliminary reaction of the body to tuberculosis infection, generalization and metastasis, and isolated organ damage or development TB of the other organ. Currently, most countries use the International Statistical Classification of Disease, which is periodically improved. The 10th revision of the classification was published by WHO. In the International Statistical Classification of Disease, verbal formulation of diagnosis are converted into alphanumeric codes and that use different countries of the world. At this picture, you can see ICD-10 codes. The clinical classification of TB used in the Russia Federation is based on several principles, clinical and radiological features of the tuberculosis process, release of bacteria into the environment. Consists of 4 main sections: clinical forms, characteristic, process, classification, residual change after cured TB. Clinical forms of tuberculosis. The main clinical forms, you can see this picture, it's like tuberculosis intoxication in children and so on, miliary tuberculosis, focal pulmonary tuberculosis, caseosis pneumonia, tuberculosis pleurisy, and so on, of course. Tuberculosis of other organ and system, it's like bones and joint, urinary, genital organ, skins, eyes, lymph nodes, and other organ. Characteristic of the tuberculosis process. Main developments, localization and extent of the process, it face bacterial excretion. Localization are determined in the lungs by lobes or segments, and in the other organ or system, determined by the localization of the process by clinical and radiological things, and by the presence or absence of Mycobacterium tuberculosis in the diagnostic material obtained from the patient. Phase of the tuberculosis process. It can be infiltration, seeding, characterize the activity of tuberculosis change in newly diagnosed patient or patient with an exacerbation of the process, resorption, compaction, scarring, calcification. Bacteria excretion. With the isolation of Mycobacterium tuberculosis, without isolation of Mycobacterium tuberculosis, we use MTB skin test. When isolating the MTB culture, a laboratory study of sensitive to anti-tuberculosis drugs is carried out. When formulation a diagnosis after indicating the presence of bacterial excretion, drug resistance to specific anti-TB drugs is obligatory note. An example, when infiltrative tuberculosis of one or two segments of lungs, we can use isoniazid, rifampicin. Drug resistance of Mycobacterium tuberculosis. It can be monoresistance, resistance to one of the anti-TB drugs, sensitivity to other drugs, polyresistance, two or more drugs, multi-drug resistance, resistance to isoniazid and rifampicin at the same time, and super-resistance or broad drug resistance, combined with resistance and one of the injectable aminoglycoside preparation. Complication of tuberculosis. It can be amyloidosis, pulmonary heart failure, spontaneous pneumothorax, fistulas, etc. Residual change after cured TB, respiratory organ fibrous focal, bullous, dystrophic, calcification in the lungs and lymph nodes. The other organ, it can be calcification, change in various organ, and we can see about effect chemotherapy or surgery with spontaneous cure of tuberculosis. The main clinical form of tuberculosis. Tuberculosis intoxication in children and adolescents. Diagnosis is based on tuberculum skin test. Clinical sites of the disease in the absence of local manifestation determined by X-ray method and research. Tuberculosis intoxication in children characterize activity of tuberculosis infection and is accompanied by deterioration in the general condition of the child, periodic increase in body temperature, loss of appetite, and so on. On examination, a slight increase in group of peripheral nodes with symptom of periadenitis can be determined. Laboratory determined by a slight acceleration of ESR shift of neutrophil to the left, eosinophilia, lymphopenia, the immune status change. Primary tuberculosis complex characterize with fibrosis and calcification in the lungs and lymph nodes, and we can see this in early age with baby. Primary tuberculosis complex, resorption and compaction stage. Tuberculosis of the lymph nodes develops in children and adults as a result of primary infection with TB. Less commonly, it's occurred due to endogenous reactivation of tuberculosis change in lymph nodes. The clinical picture depends on the volume of lesions, the age of the patient, the phase of the process, the nature of the complication. It is important, in case of late detection and an effective treatment, a traditional to chronization current primary TB is possible, characterized by a long adulting course and polymorphism or morphological change. With all variants, but most often with its chronic course, complications are possible in the form with an inflammatory reaction of the pleura and specific lesion of the bronchi with the development of segmental or lobar atelectasis, dissemination to the lungs and various organs. Objectively, paleness of the skin, peripheral polyadenia, auscultation the picture is slides expressed. Tuberculin diagnosis was usually indicated a recent infection of the patient with MTB. Disseminated pulmonary tuberculosis combined process of various genesis that has developed as a result of the spread of MTB by hematogenous, bronchigenous, and lymphogenous pathways, which is associated with a variety of clinical and radiological manifestation. And it can be acute, subacute, or chronic. No complaints or minimal clinical manifestation, it can be miliary tuberculosis. Polymorphism of change in the lungs, expansion military tuberculosis, apical-caudal extension process, asymmetric change in lungs tissue, local formation predominate over the intestinal components, the presence of zone of distraction. Difficult decrease in lung transpiration. In both lungs, a large number of monomorphic foci locate through both lungs from the tops of the diaphragms, and so on. There are no cavities of distraction can be. Disseminated pulmonary tuberculosis is asymmetric emergence of the same time of foci in the both lungs. The size of foci can be 4 or 10 mm. The foci are located mainly in the upper section of the lungs. Perhaps the apprehension of small infiltrates and zone of destruction. Most often mixed lymphohematogenous dissemination, apicocaudal spread of the process. It is chronic cause, cavities in one or both lungs, and deformation of the bronchial tree with the formation of bronchial telectasis. Focal TBL, the presence of a few foci, mostly of a productive nature, localized in a limited area of one or both lungs and occupying one or two segments, and an asymptomatic clinical cause. It's when fresh soft local process, all fibro local formation, but with sign of process cavity. Fresh local is characterized by the presence of small infiltration zone. Fibrous local TB is present of denser or more intensive foci. At this picture you can see fresh foci, fibrofocal education. Clinical manifestations are divided into two groups: syndrome of general mild intoxication, chest symptom, and febrile body temperature, decrease in working capacity, sleep, and appetite disturbance at low. Chest symptom is small constipation cord with little or not sputum, sometimes small bubbling wet rails at the higher of inspiration or when coughing. Hemoptysis, bronchial tone of breath, sometimes shortening of sound. Signs of infiltration tuberculosis is prone to destruction, subpleural location of some infiltrate, periofocal infiltration prevails over gaseous change. In dynamics, the effect part of the lungs is somewhat reduced in volume. And gaseous pneumonia, acute progressive form, it's progress with alternative lesion of the lungs tissue with the spread of the process to 3 segments or more. It manifests itself as local, acinar, or lobular infiltration with merged into zones of consolidation with the appearance of numerous sites of destruction. Tuberculoma of the lungs, a concept that includes gaseous foci of a variety of genesis more than 1 centimeter in diameter. And it could be filtrate pneumonic type of tuberculosis, conglomerate, and the so-called pseudotuberculomas. Tuberculosis can be single and multiply. They are small tuberculosis, medium, and large. Cavernosus pulmonary tuberculosis is the presence of a form cavity with the absence of prognosis fibrous change in the lux tissue surrounding the cavity. It can be infiltration, focal TB, disseminated with a collapse of tuberculomas. It is characterized by the presence of a fibrous cavity, the development of fibrous change in the lung tissue surrounding the cavity. It is characterized by foci of bronchigenous screening of various perspiration. As a rule, the bronchus draining the cavity is affected. Other change in the lungs develop pneumosclerosis, emphysema, and so on, and it is formed for an infiltrative cavernosus or disseminated process with the progression of the process. Fibrosis, cavernosus, pulmonary tuberculosis. The foci screening of various perspiration, the bronchus draining the cavity is more often affected. Kirchotic TL is an overgrowth of a coarse connective tissue in the lungs and pleura as a result of involution of fibrosis cavernosus chronic disseminated infiltrative TBL. Feature the predominance of fibrotic change over signs of specific inflammation. It should include process in which tuberculosis change in the lungs persist with clinical signs of process activity, tendency to period expiration, and sporadic poor bacterial excretion. In the classification, cirrhosis of the lungs is classified as a residual change after clinical cure. It's named post-tuberculosis change without sign of activity. Tuberculosis pleurisy. The diagnosis is established by completion of clinical and radiological signs. The affection in tuberculosis pleurisy is serious. The nature of pleurisy is determined by the result of a study of the diagnosis material obtained by puncture of the pleural cavity or biopsy of the pleura. Tuberculosis of the pleura accompanied by the accumulation educate is a specific form of pleurisy emphysema. It is developed with widespread caseosis lesion of the pleura as well as a result of perforation of the cavity or subpleurally located foci. Emphysema should be included in the diagnosis, of course. TB bronchi, trachea, upper resistant tract. I'm so sorry. There are both independent forms and in combination with other forms of TB. There are three main forms: infiltrative, ulcerative, and fistulous. Complication of them are stenosis of varying degrees, granulation, and bronchitis. Tuberculosis of other organ system, it can be urinary, genital organ, bones and joint, meningitis or central nervous system, eyes, skin, and so on. This topic will be debated in the special lecture. Tuberculosis with multiple lesion of organ and system can be classified as generalized TB, disseminated damage to the lungs, liver, spleen, kidney, and other organ and system. The clinical picture is characterized by the serious condition of the patient, several symptoms of intoxication, MBT in sputum is often absent. Miliary TB is a kind of generalized process characterized by an acute course with repeat dissemination of a predominantly productive nature with damage to various organ and system. X-ray examination of the lungs is determined by bilateral small focal dissemination in all fields. Multi-organ TB localization of an activity and inactive process in two or more organs. Formulation of the diagnosis in a patient with tuberculosis. It recommended in the following maybe characteristic of the clinical form, localization, phase of the process, bacterial excretion, complication, and so on. And you can read example of the formulation of this disease. Change in diagnosis as a result of treatment. In patients with infiltrative cavernosus TBL, the diagnosis of the clinical form after a successful course of treatment can be changed, provided that bacterial excretion stops and the cavity heals after 6 or 9 months from the start of chemotherapy. In patients with small forms of TB without bacterial excretion, a change in diagnosis when the process stabilizes impossible not earlier than after 6 months from the start of chemotherapy. For patients who have undergone resection, collapse surgery, or other intervention of TB, it's recommended. You can read this picture. It's like person who don't have any change in the lungs after surgery, and he should be diagnosed with conditional after surgery. And if certain tuberculosis change are present in the remain or collapsed lungs, teeth, or in another organ. Radiological diagnosis of tuberculosis X-ray methods make it possible to establish the localization of tuberculosis with negative results of mycobacterial and molecular genetic methods of diagnosing TB. X-ray methods allow accurate diagnostic search. Pulmonary dissemination syndrome. It is a clinical and radiological symptom complex which include all manifestations of pulmonary dissemination, difference in etiology and pathogenesis. The lesion is usually bilateral, occupy most of the lungs or total. Radiologically small or medium or large foci of lungs, maybe more than 10 millimeter. Syndrome of rounded isolate formation. On the rentgenogram of the chest organ, in frontal and lateral projection, there is a darkening that has the shape of a circle or oval with diameter or more than 1 centimeter. Direct chest radiograph in direct projection. In the subclavian zone of the right lungs field there is a round shadow with clear, smooth contours. Field and emptied cyst of the right lungs. Pulmonary infiltrate syndrome is a clinical and radiological syndrome which is based on the penetration and accumulation of several elements and biological fluids in the lungs tissue, which leads to an increase in the volume and compaction of the lungs tissue. The accumulation of only biological fluids characterize pulmonary edema and not infiltration. What do you see at this picture? Let's try to search some and try to explain. we can see defeat within one or two segments. The structure is heterogeneous focal and possibly enlarged lymph node. And let's try to see at this picture. What do you see? Ring shadow syndrome. The annular shadow is a bright and relatively easy to interpret radiological syndrome with it on radiograph in two projection. X-ray of the chest in direct projection. Ring shadow symptom, plain radiograph of the chest in direct projection, abscess of the lower lobe of the right lungs. Intrathic lymphadenopathy syndrome, expansion and deformation of the roots of the lungs. A change in the density of the roots is possible due to the calcification on the lymph nodes, which occurs with tuberculosis pneumococcis. Intrathic lymphadenopathy syndrome, a fragment of a linear tomograph of the chest in direct projection at the level of the tracheal bifurcation. The root of the right lung is expanded, its outer contour is polycyclic, a row, tuberculosis of the lymph nodes of the roots of the right lungs. Radiographic description protocol. It should be presented in the language of normal or pathological anatomy and physiology common to all medical specific and if possible, without the use of narrow professional designation and so on. You can see this picture example of radiographic description protocol. In case of deviance from the norm, the protocol summarizes the main manifestation of the pathological condition and characterize morphological change. The following terms are used to describe number of forces, shape of focus, size of force, location, and so on. It can be contours, ceiling structure, the intensity of the shadow, size. Inaccurate characterization of the lungs pattern facilitates the recognition of many lung diseases. The main type of change in the lungs pattern is weakening, straining, and accrements. And deformation, depletion, and the appearance of unusual elements. The characteristic of the functional state of organ include such symptoms as displacement of an organ or a pathological formation, change in the lumen of the trachea or large bronchus during inhalation, exhalation, coating, amplitude and direction of movement of the ribs, diaphragm, mediastinal organ with deep breathing and function test. If there are data from previous study, then a dynamic characteristic of the process can be given. In this picture, you can see the description of radiological change in tuberculosis. Thank you for your attention. Goodbye.